Welcome to the program, The Health Show. My name is Dr. Radif, and I'll be your host today. To introduce our topic, I'll have to start with these interesting findings. Do you know that Americans spend over $90 billion total on alcohol every year? That's 90. Do you know an average American consumes over 25 gallons of beer, 2 gallons of wine, and 1.5 gallons of spirits each year? And now, do you also know that every year students spend 5.5 billion on alcohol? That's more than they spend on soft drinks, tea, milk, juice, coffee, or books combined. To shed some light into this interesting, controversial topic, please welcome my guest for today, Dr. Mark Donato. Nice to meet you, sir.
Nice to meet you.
Dr. Donato is our guest today, is a practicing dental hygienist that holds a doctorate in nutrition. He is currently conducting research on the effect of alcohol on the oral health at the Arthur A. Dugani School of Dentistry in San Francisco. Thank you for joining us again.
Oh, it's always a pleasure.
So, Dr. Donato, just to make it simple, there's a lot of controversy, obviously, on alcohol. Do you think there is any benefit comes out of alcohol?
Well, actually, there are a lot of benefits.
Up to you, and I'll drink for the benefits of alcohol for now.
I think I'll join you.
Doctor. Well, first let's establish what a moderate amount of alcohol is. According to the Journal of American Medical Association, the average sized person should drink about 5 to 7 weeks to benefit.
5 to 7 glasses.
Mm-hmm.
Okay.
Yeah, to avail of the benefits. And these benefits include a decreased risk of heart disease and a decreased risk of heart attack. And this is from a study from the European Heart Journal in 2008. So another thing is we also find antioxidants in red wine. Now the antioxidant aspect is not really associated with alcohol per se, it's more so with the flavonoids in red wine. But it does have that benefit if you do drink wine. So these are about the benefits that have been researched so far.
Okay, doctor, I'll drink for that.
Oh, cheers.
So how about calories? How much calories you would say in a glass of wine?
Well, according to mypyramid.gov, in one glass of wine and about one bottle of beer, there's about 80 to 100 calories in each.
Okay, and that will affect nutrition as well.
Yes, indeed, it will affect nutrition. Say, for example, individuals who overly consume alcohol. Well, the primary alcohol that's found in wine and beer is ethanol.
Mm-hmm.
If that becomes the main source of calories in their diet, then it may take the place of other nutrient-rich foods, because alcohol in itself isn't considered nutrient-rich.
Okay.
So there may be deficiencies in vitamins such as B1, 2, 6, and 12, and other vitamins like vitamins E, D, and K, and even trace elements such as zinc and magnesium, all of which are essential to proper health of an individual. One specific deficiency that it can cause is folic acid deficiency. And if you're deficient in folic acid, this could lead to a type of anemia or blood disorder called megaloblastic anemia, which could lead to decrease in energy or endurance. And another thing is with overconsumption, you can also have another reason why you can have a decrease in energy or endurance is because it can inhibit this thing called ATP. When alcohol is in the body. Our body does this process called oxidation, which creates an enzyme, which then produces a substance called NADH, which inhibits the creation of this ATP, which makes us feel less energetic.
Oh, I see. So, in addition to the addictive nature of alcohol and its effects on the digestive system, are there any other effects in the central nervous system? And because as we know, the post feeling of alcohol drinking excessive amount probably is the feeling depressed.
Oh yes.
And that's one of the effects of alcohol. So would you say, I have interesting emails that we'll have to respond after these messages. So we'll go into a break and we will be right back to answer with Dr. Donato to answer some questions that we have received.
Okay, sounds good.
From our brain to our liver, alcohol affects every organ of the body. Alcohol depresses our nervous system after it's quickly absorbed from the stomach and small intestine into the bloodstream. Liver enzymes metabolize alcohol, but the liver can only handle so much at a time. About 1 drink an hour. That's equal to 12 ounces of beer, 8 ounces of malt liquor, 5 ounces of wine, or 1.5 ounces of 80 proof distilled spirits or liquor. So if you're putting down more than that, the extra alcohol circulates through your body. Remember that a variety of factors determine how a person reacts to alcohol. Some of those factors include a person's ethnicity, their physical fitness, the amount of food eaten before and during alcohol intake, drug use, prescription medicines, and family history. You can find more health and wellness tips on ICU.com.
Hello again, and we're back with our guest today, Dr. Donato. So doctor, back to our topic, overconsumption of alcohol and its harmful malnutrition effects. If you have anything more to add to previously before the break, and I hope you enjoyed the messages during that break.
Well, in addition, alcohol, consumption of alcohol can prevent the absorption of folate and, as we said before, B vitamins. Now, let's talk about folate in general. Now, a decrease in folate actually has been found to increase the risk of breast, colon, and other types of cancer. For the developing fetus in our pregnant patients, we find that a decrease in folate and B vitamins affects the development of the embryo's spinal cord, as well as their ability to synthesize DNA, which is an issue. In fact, we really strongly recommend that our female patients who are pregnant do not drink alcohol. In fact, it says on all alcohol containers by the Surgeon General that it can cause fetal defects. And these can include fetal alcohol syndrome, mental retardation, early memory loss, ADD, ADHD. So it's really essential that our female patients who are pregnant do not drink alcohol during that time.
So there's a strong correlation between drinking or excessive drink of alcohol and birth defects and alcohol.
Indeed, yes. There is a strong correlation.
Okay, so that's a good advice to be taken in consideration. And moving on, I have an interesting email that we received during the break from our permanent guest viewer. She's a guest and viewer, Professor Paula Watson, and she's wondering if there is any correlation or any effect, direct effect, just like the effect on alcohol, excessive use of alcohol on the central nervous system, if there is any relation with the oral cavity.
Actually, there is. With my current research, we've been finding a lot of findings in the oral cavity associated with overconsumption of alcohol. Let's first talk about pH, or the acidity of alcoholic beverages. So wine in itself has a pH of 2.3 to 3.8, which, if you look at a scale, on an acid scale, that is fairly acidic. Beer, on the other hand, has a pH of 4, less acidic compared to wine, but still classified as acidic. Now, if you have a decrease in pH or increased acidity, this acid can actually dissolve the tooth enamel, which is the hard layer that protects our teeth, and this will cause our teeth to become more soft or more sensitive, and even less white. This is what we call in our field of dentistry acid erosion.
Oh, acid erosion. And do you advise any patients who are suffering from excessive drinking of alcohol, because it's addictive in nature, it's a disease? So do you suggest anything for them?
Well, what we really recommend is that our patients undergo preventive dental hygiene therapy. Now, this can consist of what we in our field call scaling and root planning, which some people in layman's terms are maybe a deep cleaning, and maybe a curettage. And what we've been finding is that once the removal of the hard deposits or tartar, or which we call calculus, is removed from the oral cavity of our alcohol patients, they feel a sense of well-being that's associated after treatment. And in fact, this sense of well-being has been correlated to an increase in the amount of individuals who would like to abstain from alcohol use, which is essential. And we really recommend that alcohol use be limited because of other oral signs and symptoms, such as glossitis, which is inflammation of the tongue, angular chylosis, which is like cracks on the sides of the mouth, or gingivitis, which is inflammation of the gums. So these are things that we see, and if people limit their amount of alcohol, especially those who are considered heavy drinkers, their oral health would truly benefit from it.
So it was an excellent question, Professor Watson, and along with Dr. Donato said, there is an increased risk of carcinomas and oral cancer for people who excessive drinkers for alcohol, and increased risk of lower flow of saliva, which will increase their caries risk.
Oh, indeed.
And that's another issue to be taken in consideration, because the more your mouth is dry, the more incidence caries risk is just go high rocket.
And for your audience, those who are not familiar with caries, essentially, the chance of getting cavities.
Yeah. So thank you so much, Doctor, for shedding this light on this quite interesting topic. It's still controversial, and probably it will stay controversial for a long time. Thank you so much for having.
My pleasure.
Thanks.
Nice meeting you.
Nice.
What is the malted liquor? What gets you drunker quicker? What comes in bottles or in cans? Beer! Can't get enough of it. Beer! How we really love it. Beer! Makes me think I'm a man. Beer! I could kiss and hug it, beer! But I'd rather chug it. Beer! Got my belly out to here. Beer! I could not refuse it. Beer! I could really use a beer. Beer! 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 I can't remember how much I have had.